वेलकम टू RRB NEXUS। इन आवर रैंडम क्वेश्चन एंड आंसर सेशन हमारा प्राइमरी गोल है कि आपकी परीक्षा से पहले हम सभी सवालों का कवर करें जो कि परीक्षा में सबसे ज्यादा संभावित हैं। और ये सवाल पिछले वर्षों के नॉर्सेट, AIIMS, RRB, ESI, PGIMR की परीक्षाओं के प्रश्नों पर आधारित हैं। Join us regularly to make sure your selection.
Which of the following is not a feature of HELLP syndrome? A. Thrombocytopenia. B. Eosinophilia. C. Raised liver enzymes. D. Hemolytic anemia.
And the answer is option B. Eosinophilia. HELP syndrome. Severe pregnancy complication. Affects liver and blood. Acronym: hemolysis, elevated liver enzymes, low platelet count. Symptoms: abdominal pain, nausea, headaches, swelling. Can lead to liver rupture, bleeding, organ failure. Requires immediate medical intervention. Treatments include delivery and supportive care. A. Thrombocytopenia, low platelet count. Feature of HELLP syndrome. B. Eosinophilia, increased eosinophils. Not associated with HELLP syndrome. C. Raised liver enzymes, liver dysfunction. Seen in HELLP syndrome. D. Hemolytic anemia, destruction of red blood cells. Feature of HELLP syndrome. In summary, option B, eosinophilia, is not a feature of HELLP syndrome, while options A, C, and D are all associated with the condition.
Which of the following measures should the nurse include in the home care plan for a child being discharged from the emergency department with a diagnosis of acute glomerulonephritis? A. Restrict fluid intake. B. Weigh the child daily. C. Maintain strict bed rest. D. Limit visitors.
The nurse should include option B, weigh the child daily, in the home care plan for a child being discharged with a diagnosis of acute glomerulonephritis. Here's a simple explanation of each option. A. Restrict fluid intake, not recommended as it may worsen fluid retention. B. Weigh the child daily, important for monitoring fluid balance and detecting changes. C. Maintain strict bed rest, not necessary for all cases, depends on severity and symptoms. D. Limit visitors, may be helpful to prevent infections, but not the most crucial measure.
As a nurse, when teaching a client who has had surgery to increase a nutrient for tissue repair, which of the following options would you choose? A. Fats. B. Vitamins. C. Proteins. D. Carbohydrates.
And the answer is option C. Proteins are essential for tissue repair after surgery due to the following reasons. 1. Building blocks. Proteins contain amino acids, which are vital for tissue regeneration. 2. Wound healing. Adequate protein intake promotes the formation of new tissue and speeds up wound healing. 3. Immune function. Protein supports the immune system, helping to prevent and combat infections that may hinder healing. For muscle recovery, protein consumption aids in muscle recovery, preserving muscle mass, and restoring strength. In summary, increasing protein intake facilitates tissue repair by providing building blocks, promoting wound healing, supporting immune function, and aiding in muscle recovery.
Which of the following is commonly observed in a fetus with congenital CMV infection? A. Colitis. B. Pulmonary cyst. C. Myocarditis. D. Blood dyscrasias.
And the answer is option D, blood dyscrasias. CMV, cytomegalovirus herpes virus, causing widespread infection, often asymptomatic but can cause serious complications. Summarized explanation of why option D, blood dyscrasias, is commonly seen in fetuses with congenital CMV infection. CMV infection during pregnancy can affect the development of blood cells in the fetus. It can lead to abnormalities or disorders in the blood cells, known as blood dyscrasias. Blood dyscrasias can manifest as low platelet count, thrombocytopenia, anemia, or abnormal white blood cell counts. These abnormalities can impact the overall health and functioning of the fetus. In summary, congenital CMV infection can result in blood dyscrasias, causing various issues related to blood cell development in the affected fetus.
And for additional queries, search on YouTube RK Edu Nexus, and get brief note on topics, join our Telegram channel, same name RK Edu Nexus.